Hi guys, welcome back to my channel. I've got some exercises now I wanted to show you for your fistula, for your forearm, okay? So caregivers, please invite your caregivers in. It's probably really good for your caregivers to watch this video as well so they can help you. It might actually help them as well. So what you do is you stick your arms out as far as you can, stretch your fingers, and then turn them over just slightly. Now, at any point in this, if you're hurting, stop. Don't do this, okay? Just don't. That means there's something wrong, or you're just too stiff from dialysis, or I'm not really sure. It means that you're just too stiff. So just stop immediately if this hurts you. Put your hands back over like this. Now grab, like you're grabbing something, and hold it for about 5 seconds. And then turn your wrist slowly, like that. Open them up one more time, and then close them into a fist, and then open them up one more time, and turn them over. And this is what I do to kind of warm up before I do the exercises. I just kind of push my hands together like this, and then right where your wrists are, take the bottom of your hand here, kind of rub the bottom of your wrist, and then rub the other side of your wrist. These very gently, you guys, very gently. And then put your fists together again and kind of move them in one direction. Again, if this is hurting, stop, and then try and move them together around in this area. This will kind of loosen up your ligaments and help your flexibility, okay? And then put your hands together like a prayer. Bring it up like this. Now it depends on what your flexibility is at this point. You want to try and move your hands this way a little bit, and then back to center, and then the opposite way, and then back to center, and then try and put your elbows in, and then slowly pull your elbows out, because you're stretching your wrists now, and your hands and your fingers, and go as far as you can go. Don't, on the first, I don't know, first 20 tries, don't go all the way out. And try and keep it as close as you can to your chest. And then pull it back in. Okay? You might feel a little tingling, so you may want to just kind of shake it off. Alright? And another thing that I do is I'll take one of my hands, put my hands down on the counter, and then take your hand, take your index finger and your thumb, and touch it. Your next finger, touch it. Back down to the flat, touch it. Back down, and touch your small finger, the smallest finger. And back again to your other finger, to the smaller finger, and now to your index finger. And then open your hand up and close it, open, close it, put your hand down, do the same thing with this finger. Touch them together. 2, 3, 4. Again. something, and then put your hands down. Now some of you, when you're first doing this is going to get you really sore, so don't do any more. I've got some other exercises I'm going to show you, but those are for people that have been doing somewhat of an exercise with their hands. Here's one for the records. I'm sure you remember doing this in school. If you can do this, is move your fingers up, over, okay, about 3 times. Some of these are really kind of hard to do. You're just creating flexibility. And you want to have flexibility. If your other fingers fling out while you're doing that, that's okay. Just try and keep them down. If you can't do them at all, there's some fingers I can't even do it with. But you will become flexible after doing these for a while. And then do your small fingers. See my other fingers getting stuck doing that with that one. And then do them together. And then kind of move your thumbs around. If you notice that you have a lot of pain in any of these fingers, again, consult with your doctor and nurses about these exercises first before you do them. But if you notice pain, like I've got some pain in both of my thumbs, what I do is after all the exercises are done, I'll show you how to do the massage, but I will know now exactly where to exercise, whether you have arthritis or just it's been a long time since you moved your fingers that way. Okay? So again, stretch your hands out, put them in fist. So if you have something like this spun, this is kind of cool, it's a kidney, you just squeeze it, okay? Give it about 5-6 squeezes. And then turn your hand and your arm out, squeeze it like that. And then squeeze it like this. Same for your other hand. This creates great blood flow for your fistula and for your forearms and your fingers. You're not going to turn out to be, you know, an Arnold Schwarzenegger or Popeye the Sailor Man, but what you're doing is you're promoting the blood flow and keeping strength and hopefully preventing any clots that may be through there or just sitting there. There you go. And what I do is I take either this one or this one. This one's a heart, this one's a kidney. And I take both of my hands, put both of my fingers on it, and kind of squeeze like that. And then just turn it in a circle. Turn it in a circle. Okay, if you're hurting at this point, stop. Those of you that can follow along, just keep following along with me. Okay. There's the kidney. You can do the same with the heart. The heart's a lot more stiff than this kidney is. I think it pretty much worn this kidney out over time. And again, if you can, start squeezing it with your fingers. And then just give it. Now, some people say that they can do this in dialysis. I've got to tell you, I'm a dialysis patient and I would not do any of this. I don't even want to move because I don't want to feel those needles move. So I've heard some of the doctors and the nurses on TV say, you know, you can do this while you're dialyzing. I don't think you should be exercising at all when you're dialyzing because the dialyzing machine itself is pulling on your heart. You're getting enough exercise that way. If you get stiff, just move around. But, you know, just do this. Okay? And the last one that I've got for you guys is a clothing. You remember this? This is a clothing clip. What I do is I make sure that I hold it with one hand and allow it to go up and down and just pinch. 1, 2, 3, 4, 5. And I come to the other one and I'll pinch 1, 2, 3, 4, 5. And if you can, try and do it with your other fingers and pinch. 1, just using this to hold it. 2, 3, 4, 5. 1, 2, 3, 4, 5. Doesn't have to be wide open. And then on your small one, 1, 2, 3. See? Kind of gets you away from you. 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. I don't even think I can do this with my small pinky, but we'll give it a go. 1, 2. Now I can't do it with the small one, so if it becomes difficult, just don't do it. And it doesn't matter if it's upside down or right side up, as long as you're pinching it, trying to use all your fingers, that's good enough. So from there, what I do is I will take a throw blanket like this, okay? And what I do is I'll take the end of it with my fist like this and start rolling it up, okay? Grabbing it as hard as I can as I'm rolling it, trying to make it as small as I can and roll it. This is just a throw blanket. You can use this or anything else. I always use what I've got around the house because it's senseless to go out and buy things when you already have it around, right? So you just kind of push that down like that. Okay, there you go. And then what you can do is you can roll it back out and you can start all over again. Seems pretty simple, but it really helps your forearms, helps the flexibility, helps give you better grip. You have to grip things in this life to pick up small items, or you're brushing your teeth or bathing and stuff like that, and it's better that you've got perfect blood flow in your arms. Now I've got another version of this, and this is a small hand towel. I'll just show you. It's just a small hand towel, and just fold it in half. Put it on the counter somewhere, or if you cannot stand, you can put it in your chair and put it on your lap and roll it up again. Just come down like this. You don't have to be in a hurry. You can take your time and just keep rolling. Just like that. Okay. And then you just roll it back out again and start over. This works really well. It's really improved my grip over the years, I gotta tell you. There we go. That's an example on that one. And if you've got a regular wash towel or a wash rag, just lay that out. And this will give more of an exercise on your fingers as well, is just kind of roll it up with your fingers as tight as you can. Repeat this as often as you want to. I wouldn't suggest doing it on dialysis day at all, but again, ask your doctor, ask your nurses how that works for you. I mean, you can do this just about any way that you would like to do this, to roll this up. But this will help your grip, okay? And what you can do on the longer rags is you can kind of grip it with your hand too. Grip it down like that. Okay? Towels are great. They really are. I use the towels the most, I would say, out of all of the exercises that I do the towels the most. And it really helps. You've got to keep that circulation and that blood flow going within your AV fistula, so that it helps the output and keeps it big, keeps it healthy. It won't get large, ladies, if you're doing this, so don't worry about it, becoming manly on you overnight, because it won't happen. It's just going to keep it healthy, flowing great, and these are great. You can pick these up just about anywhere. I think the old-fashioned ones, you guys, when they had there was a loop in the middle and it's a bar and it's got 2 handles on it. Excuse me. That's not so good. That's really not so good, because I used to have one of those, and what happened is in the inside of my palm here, I got a bruise. And you don't want to bruise yourself. These won't bruise. So you just keep doing this. And when you're done, make sure you stretch out your hands and your arms, just like this, away from your shoulders. All right, now when you're completely done with your exercises, what you want to do is you want to pull back your sleeves just a little bit, or have your caregiver pull back your sleeves. And I want to show you, it's great to do a little bit of a massage, maybe just a little one before and a little one after. So what you do is you extend your forearm out, and you're kind of like not putting any pressure at all on this, and just kind of putting your hands over it. Okay? Don't push down on the fistula at all. But when you get around to your hands, start putting a little bit more pressure on it. And then rub your finger from the palm to your finger, and then up each finger. Okay, this really helps as well. And then when you get to your wrist part, just kind of go in a circular motion with your wrist, not with your fingers. It kind of makes it's very uncomfortable for me to feel the fingers. So I take the bottom part of my thumb here and I move it around. I just move it around. There we go. Just move it around like that. And then gently just move it around the fistula. Just a little bit, not too much, you guys. And then up, and then down. And a nice circular motion. You can do this putting lotion on too. That would really help too. But you really need to do this. You need to take care of your fistula. Okay, now you move to the opposite side. Kind of rub your wrist here at the bottom. Just move it around in a circular motion. And then go up your wrist. Now this doesn't have a fistula on it, so you can put a little bit more pressure on that. Go up and go down, and then around, and then push on your palm up to the top of your finger, from the bottom of your palm up to the top of the other finger, from your palm up to the middle part of your finger, and then up to your index finger here, and then up to your thumb. Okay, be good to your hands and your forearms, and then I like you're washing your hands. Rub your hands, rub your wrists just like that. Back and around, slow. You can do your forearm like that. It's just be careful on the fistula side. Okay, move them around. Now some folks like to take it all the way up to the top and then pinch the end. Up to the top and then pinch the end of your fingers to release tension. And then up to the top. And then same for this side, up to the top and pinch. Up to the top and pinch. Up to the top and pinch. You can do it this way and you can do it this way. Up to the Just do the fingers part and then pinch the ends, the finger part, and then pinch to the ends. Okay, now what you want to do is put your hands together again and then just squeeze, squeeze, and then again. You should feel a little bit sore. You just want to go in both directions and then go up and down, and if you can, go sideways. You should feel something right here in your wrist. Put your hands out, do the same. Up and down, up and down, up and down, to the center, and try and see if you can move them to the left and to the right. There you have it. Okay, and then again, with your thumbs and your fingers, you just want to kind of move them around a little bit. And back to your fist. And back to your fist. Now you can roll one more time, or you can squeeze one more time, or you can pinch one more time, or you can just go to a smaller rag. Whatever it is that makes you feel most comfortable, try it. But these are and then of course the throw towel or the throw blanket that's a little bit larger than the others. This will be quite a challenge when you first try this. I know when I did, I kind of laughed about it, but I got through it. So I hope that helps you guys. Please like and subscribe, because it helps me be able to get more of this information out to patients like myself and to their caregivers. So that will help and benefit the dialysis patients and the caregivers to know what their options are, and just pull from items around their house. Again, thank you for taking your precious time to view my channel, and I hope to see you guys very soon. You have a wonderful day.